Time for To Your Health, and this morning we're talking about staying safe in this heat. It's a whole lot easier to do than just jumping into a pool, and it is a serious matter. The National Weather Service says each year in the U.S., heat kills around 115 people. Serious topic here, so Dr. Jason Booth with MercyCare Vernon Village is here with the information that you need to know. Doctor, we've been talking about this. We hear so often on days like this, stay hydrated. So how do you stay hydrated in conditions like this, and how much is too much and what don't you drink?
Well, it's very important to stay hydrated. The average adult may need somewhere around 8 to 10 8-ounce cups of water, or 8-ounce glasses of water a day.
So that's what you do drink, water. I'm sure that's what you say you do drink.
That's what you should do.
What don't you drink?
You do not drink excess caffeine. Alcohol can dehydrate. Too much caffeine with alcohol can stimulate the body to get rid of too much urine, too much fluid. That will contribute to more dehydration and heat problems.
Let's move on to our next topic here. Heat exhaustion, heat stroke. We hear a lot about those illnesses, those maladies this time of year. How do they differ, and what are the warning signs?
Heat exhaustion is a precursor to heat stroke.
Okay.
Heat exhaustion happens as temperature rises in the body. The body is unable to get rid of extra heat. Humidity in the air contributes most to that. If you can't evaporate heat from your body because of all the moisture in the air, that heat rises in your body.
So humid days like we're having here lately, those are especially dangerous times for heat exhaustion and then heat stroke.
Humidity is more important than the actual air temperature.
Really?
So,
okay.
Yeah.
So then what are the warning signs? What should we be watching out for with heat exhaustion and heat stroke?
Heat exhaustion, you will see a variety of symptoms. Dizziness, headache, nausea, vomiting, mild confusion, flushing of the skin, but as that body temperature rises, the heat will start damaging the internal cells of your body, where you'll then see more confusion, seizure, low blood pressure, passing out, and those are the symptoms you have to be looking out for.
Got to ask you real quickly here, we're running out of time, but who is most at risk in conditions like these?
Most at risk are elderly, young kids, people who have underlying medical conditions with different medicines, heart disease, diabetes, obesity. It even happens in healthy, young, fit people like yourself.
Okay, but we hear so often, keep an eye on the elderly and the very young. That's good advice.
Yes.
Okay, Dr. Booth, we appreciate your time this morning. We appreciate your time, and keep all of his tips in mind on hot days like these.